Good evening, everyone, and welcome to tonight's webinar, all about imaging technology. I'm delighted to be joined by Dr. Kamran Amjed, who is one of our new advisory contributors. We're chuffed to have him on board with us. He is involved in reviewing articles and producing content for the Regenerative Aesthetic Medicine Institute. Cameron is an experienced doctor, AI health tech advisor, and founder of the CPD accredited consultation catalyst training program. He's got loads of experience and particularly now has been exploring imaging technology, so is perfectly placed to share his advice, what he's been learning, and the experience he's had, and how it can benefit our aesthetic patients. So I'm going to now hand over to Cameron. If anyone has got any questions, do pop them in the Q&A throughout tonight's webinar. And once Dr. Cameron is finished, we'll run through as many as possible. So thank you all, and over to you, Cameron.
Thank you, Chloe, and thank you for everyone joining this evening. I'm really excited to talk about this topic because it's really about where the future of the industry is going in regards to regenerative aesthetics. And one of my favorite topics, AI healthcare, more particularly AI imaging technology and how it's going to impact the future of our industry. So the title of the webinar is "Seeing is Believing: How Imaging Technology is Transforming Patients' Understanding." A bit of an overview of what we'll be covering today. So I'll be talking, as Chloe mentioned, a webinar hosted by RAMI, the Regenerative Aesthetic Medical Institute, that I proudly sit on the board of the growing role of imaging technology within the regenerative aesthetic space specifically. Okay, I'll talk about that in a bit more detail later on. And this session will discuss how enhanced visualization can improve patient understanding and support treatment communication for more appropriate imaging devices for your practice as well. Okay, so what we will learn, just going to minimize this. What we will learn is why regenerative aesthetic treatments are often harder for patients to see compared to other treatments such as toxins and fillers, how AI imaging technology is transforming the modern consultation process, the psychology behind visual understanding and how patients' decision making is altered and affected by the use of imaging technology, how imaging technology is improving treatment planning, building patient trust and long-term patient adherence, and also we'll be covering the future of ethical imaging-led consultations in regenerative aesthetics and in healthcare as a whole. So why does this matter now? Because as some of you have noticed, there's a massive shift happening, not just in medical aesthetics, but just in the world in general of AI. Artificial intelligence has come out of nowhere almost and is now a major part of our lives. And even if you don't want to use it or understand it, it will impact your day-to-day lives, including your clinic space. And not even if you're not comfortable with it or you don't have any interest in it, it will impact your patients' lives and they will expect to see it in your clinics. So patients are now more educated than ever, but also they're more confused. There's a lot of information out there. We have more information readily available now to ourselves and to patients. So it's more important now to focus on this, and they need something more than just a simple before and after image to help them understand it. Regenerative treatments are harder to see. We all know that regenerative treatments are slow. You get cellular repair first before you get visual repair. So patients often struggle to see this. More so now, especially with the younger patients, there's a struggle for delayed gratification. People want things now, immediately. They're used to having things such as Amazon delivery on availability on hand. Deliveroo, Uber, everything's so readily available. So when you're trying to sell them something that's going to take a bit of time, it's hard for them to adjust to that. Consultations are becoming more complex as the industry is becoming more complex. We have new devices, new injectables, new regenerative offerings. So your consultation is going to be a little bit more complex, which is why you need some support from imaging technology. And AI imaging is reshaping the way we communicate. Okay. So we've moved from treating lines to treating biology. It's something I say to my team all the time. I said, look, guys, we're not just treating lines and wrinkles anymore. We're actively treating biology, and we need the tools and the communication tools to effectively transfer that information to our patients in a clear and concise manner. So why should you listen to me? What the hell do I know about consultations and regenerative aesthetics? For those of you I've not had the pleasure of meeting or getting to know yet, my name is Dr. Kamran. As Chloe mentioned, I sit on the board of the Regenerative Aesthetics Medical Institute. I'm a former A&E doctor and acute medical doctor. Been a doctor now for just over a decade. Left the NHS in 2018 to start my career in advanced aesthetics medicine with a level 7 diploma. Became a trainer as well. Founded my own clinics. First one about 4 years ago in Manchester. We've opened four since then, where we've been doing loads of consultations. I've got CQC experience, AI in healthcare diploma from Stanford in 2024. Sit on the advisory board, as I mentioned, of Rami, but also some other um, device companies and laser companies, some of them we know, such as Hydrofacial. I operate a lot in the clinic as a clinical lead in the GLP-1 sector as well, which I'll tie into a little bit in how that ties into regenerative aesthetics. And when I'm not doing that, I'm the consultation coach for Consultation Catalyst. Okay. I've done, on average, I do about 650 new consultations per year. That's an average of 14 per week. And I'm proud to say that I've achieved a 92% conversion rate. And that means patients that have committed and purchased a treatment protocol, more specifically, a regenerative treatment protocol made on the day or within 7 days of that consultation, thanks to its clear and concise manner with the use of imaging technology. 57% of those consults that I do in a year are regenerative aesthetics consults for face, body, and hair. So over more than half of my consults now have regenerative aesthetics in them in some capacity, either directly or as a supportive measure. And one thing that's really important here at the bottom is in every single one of those consults across all four clinics that I've launched in the past 4 years, I use imaging technology in every single consultation. That's paramount, and I'll explain why. Every single consultation has to have imaging technology, and we were doing this before the AI boom. So now it's more important. I've also developed the first ever Consultation Catalyst CPD approved consultation training program in the industry. And these are some of the companies that have had that training and have taken my advice to invest in imaging technology to better enhance their practice and patient experience. So I know a little bit about consultations and a little bit about regenerative aesthetics, which I'm going to share with you today. So what's the problem with regenerative aesthetics? We know the amazing wonders and the power and the amazing results that we can get and the capabilities of regenerative aesthetics. We all know and love those. And our patients are enjoying those as well. What a time to be alive. But it does also present a problem as well. And what's the problem is that there's this invisible progress problem. People, as I mentioned at the beginning, they do not have the patience anymore. Collagen remodeling, cellular regeneration is a slow, arduous process. Tissue quality often changes before the visible changes arise. Patients often forget their baseline, where they started, because it's such a long treatment plan, 4, 5, sometimes 6 months plus. They forget where they started and they feel like they haven't had much of a difference. Mirrors are very subjective as well. Mirrors are very subjective. The way someone sees themselves compared to how we see them, it's all very subjective. Patients often tend to feel better before they see the improvement. So the skin might feel a bit better, but they still might say, look, I don't look better. And this is where imaging technology really supports us. Patients often experience biological improvements before they visually recognize the changes that these regenerative treatments are offering them. So why humans trust visual information? Okay, I just want to focus a little bit before we jump into how I implement this into my consultation framework. I want to actually just focus a little bit on where this sits in the human element of the psychology of your patient. So humans, we as humans tend to process visual information a lot faster than verbal explanation, verbal information. Okay, patients tend to remember what they see more than what they hear. Visual proof also reduces the uncertainty and the skepticism in a patient's mind. And with increased uncertainty, with more assurity, it improves the emotional buy-in. If people are feeling certain in you and your treatment plan, this long regenerative treatment plan, they are more emotionally bought in. And also it improves patient adherence. You know, often people get excited at the beginning. Oh, yes, these polynucleotides or these exosomes and all of these regenerative treatments are going to really change everything. They get excited at the beginning, but they don't stick with the plan because 4 or 5 months, sometimes it's too long. So patients don't buy treatments, okay? They buy the understanding. And that's where I feel that visual technology and imaging technology will help them with that understanding. Following on from that, just to continue on, we as humans tend to approximately remember when it comes to information retention, 10% of what we hear, only 10% of what we hear. Only 20% approximately of what we read do we retain. I can certainly vouch for that. When I was in med school, I would only remember about 20% of something I read. I had to read it over and over and over again. But over 60%, 65% of what we see. And again, a lot of people, including myself, I personally am more of a visual learner. If I see something on video, I remember it a lot better than if I read it if someone explained it to me. Okay. So just keep that in mind that it's not about how good you are. It's about how good your patients understand how good you are. And that's why, we need to find a modality that we can effectively communicate and transfer the information of our treatment protocols to our patients. And a lot of it is due to clear and concise communications that we teach in consultation catalyst, but also you need some tools. Even if you're a great communicator, your patients will not remember what you've said. They will remember what they saw. So couple visual imaging, visual aids such as a TV screen in your consultation room, along with imaging technology, because they will remember approximately 65% of that. Okay. And you'll often find, if you look at the 10% figure, this is why patients often leave consultations forgetting the explanation, but remembering the visuals. Let's now talk about how visualization changes your patient's behavior. Okay, patient behavior. So patients don't want treatment recommendations anymore. They want a roadmap. They want a roadmap on this long regenerative journey that they're about to embark on. Regenerative aesthetics, as I mentioned, is slow, gradual, and cumulative. As I mentioned, as humans, we struggle to perceive, subtle daily changes, and we emotionally adapt to the reflection rather than just the explanation. Imaging provides an orientation, progress, and clear clarity, concise and clear results and treatment plans for your patients. So visual tracking is also very important for improving the patient confidence and patient adherence. The reason I've got a Google Maps icon there is because imagine someone was to give you directions only verbally. Imagine you were in your car and you're driving from one destination to another, and it's a long 3, 4, 5 hour drive, and you're only going to get verbal cues from your sat nav. Guaranteed, we're probably going to miss an exit. We're probably going to make a wrong turn. We're probably going to make some mistakes on that journey. We need a screen. We need a screen to look at where we're going. I know for a fact that when I'm driving, I often have it on mute and I just follow the blue line on the sat nav. So the same way your patients need some visual guidance using imaging technology on this long journey that they're about to embark on. Okay. Without visualization, regenerative medicine can just feel like asking a patient to trust the journey that they cannot see. Why visualization changes commercial behavior now. So that's changing general behavior in relation to the journey. Here's how using imaging technology in regenerative aesthetics can impact your patient's commercial behavior. So imagine this, okay? Patients are more willing to invest in treatments they can visualize. High value decisions are driven by emotional confidence more than logic, or just as much. Luxury industries rarely sell concepts without visual representations, and I'll come to that on a slide next. Think about this. Anything you've ever bought, expensive, anything, any major decision you've made, you've always had some sort of 3D rendering or imaging. Okay. People are far more comfortable investing in the outcomes that they can see rather than the outcomes they are simply just told about. If you're going to buy a new car or renovate your house, you wouldn't just buy it just on the description of the interior designer or the car salesperson. Look at this one here. If anyone's going to buy a Bentley, you're not going to invest in a Bentley or a car without at least having a 3D render of the beautiful car that you've designed with the person from the showroom. You're going to sit there, you're going to map it out just like you map out a treatment plan, and he's going to make you a 3D render to say, this is what your car is going to look like in 5 to 6 months' time when it comes out the factory. Same way with interior designing. You're about to make a large investment. It's going to take some time. Okay, no, you're not going to build a brand new house within 4 or 5 days. It's going to take months, sometimes up to over a year. And the interior designer or the architect will make 3D renders to help you have a clear idea of what success looks like, what the end result is. And then you will feel a lot more comfortable parting ways with your hard-earned income to invest in that. The same way is with your patients. Do not expect them to invest in a long, arduous journey of sometimes these regenerative protocols can go into three, four, £5,000 plus, sometimes even £10,000 plus. And if you're expecting your patients to invest in you and your treatment plan without visual imaging or some sort of 3D rendering, then you're essentially expecting them to invest in something like as if someone was asking you to buy a car or a house without looking at it visually. So just think about that next time you try and explain it to them without any visual aids or without any imaging technology. Before and afters are no longer good enough. They're just not, they're no longer enough. Okay. We need a lot more. Patients are expecting a lot more. These images here used to be good back in the day. Yeah. Traditional photography is outdated now due to inconsistent lighting, variable angles of where we're standing. One person might take a photo one way, one person might take a photo another way. Patient skepticism. This one, it looks like it's been altered here. We don't know. How can people trust it? Social media distrust as well. People are using filters on their before and afters. So using objective 3D imaging AI technology that can't be edited and will show the patient will improve all of these things, including trust. Modern patients want objectivity, not subjectivity. The way you look is subjective. I might see someone one way, they might see themselves another way, but data doesn't lie. Okay, this is where AI imaging enters the game. So, with that, here's the rise of AI imaging, why modern imaging systems and what they can do, what they can now do. Okay, a lot of people don't actually realize the potential of modern day imaging technologies. There have been a few in the industry for a while now. Okay, we all know the big major brands where you stick your head in a big egg and it takes pictures from side to side. We've gone far beyond that now. We now have AI integration, 3D facial mapping. Where do you sit in the general cohort of people in your age bracket and Fitzpatrick scale? You can actually see where you sit in the percentile. Volume loss analysis, okay? Skin quality tracking. We can have this. One thing I really love, I've put it in bold on purpose, is the predictive aging simulation, okay? These are the advanced AI systems that are now introduced and incorporated in the modern day imaging technology and objective progress reviews. Newer systems, like the ones I use in my clinic, such as Aura, there are others as well in the industry, have AI assisted imaging platforms, are beginning to shift consultations from subjective discussions towards visual analysis. And by the way, this is what your patients expect. They expect AI to be present in their clinic as well. They have AI in every aspect of their life now, their phones, their work, their cars, everything. So when they come to your clinic, if you don't have some form of AI imaging technology in your practice, you're going to be left behind and your patients are going to feel like you're an outdated clinic. So this is just a natural expectation from your patients moving forward. This is where the industry is going. So now I've talked about why imaging technology is so important, the utilization of it, what happens if we don't use it, how it impacts patient psychology, how it impacts patients' commercial spending, how it links and tackles all of the issues with long, arduous regenerative treatments. We've talked about that. Now I'm going to talk about how this exactly sits and where it sits in your consultation practice. Okay. So by now, if you haven't been convinced already, or if you haven't got a scanner, you should get one by now. Okay. You should have some form of imaging technology, especially if you're offering regenerative treatments in your practice. But now I'm going to talk about exactly where it sits in your day-to-day clinical practice. So what is a consultation and how do we assess the regenerative capacity of your patients? Well, I want you to think about medicine as an information gathering game. There are various forms of information coming your way, no matter what aspect of medicine you're in. I used to be an A&E doctor, so I had information coming in various ways. I had patient history over here, family history, ambulance reports. These are all valuable information. Visual inspections, I would look at my patient. Do they look cyanosed? Do they look fatigued? Do they look delirious? I can look at them and see a lot of information coming my way. Physical examination, I would check their auscultation for their heart, percussion on their lungs. I'll palpate their abdomen. These are giving me valuable data that I can see. Is my patient in pain? Can I feel anything? Can I feel a mass? Do I need to do an X-ray? Bloods, urine dips, swab tests, all of these kind of things. But here, I want to focus on this aspect, the imaging side, X-rays, CT scans, MRIs. We've been doing this in medicine forever. Okay. Now, aesthetic medicine is no different. You need to gather information, but it's just different information. Now, even if you're not a medical professional, if you work with a medical professional, or if you're offering regenerative aesthetics in your practice, you still need to gather the same amount of information. And the rule in medicine or in anything when it comes to making treatment plans is the person with the most information wins. When I was an A&E doctor going back here, the win was to save someone's life. If you come on to aesthetic medicines now, the win is to make the correct treatment plan that's actually going to get the result. And this is where imaging technology sits. It's one of the most paramount forms of imaging information coming your way. And the more information you have as a practitioner, the better positioned you are to make the correct treatment plan and manage expectations that are aligned with the patient's desires and outcomes. So I always say you can only improve what you measure. Okay. And just to show you where I actually scan and where it falls into my consultation, it's right at the beginning. So as soon as a patient walks in, they do their consent forms. One of my front of house members or clinic supervisors will take the patient, and I always have my imaging scanner in various clinics. We have different ones, but now I have Aura everywhere. But I always get the front of house to scan them before they come into my consultation room, because that way, if I go back here, I've already got one piece of information coming my way. Then it's my job in the consultation to then ask them the appropriate questions, the framework that we cover in Consultation Catalyst, of course, but we ask them the appropriate questions here. I'm gathering more information. I'm looking at them. I'm having a physical examination, maybe doing a snap test, maybe doing a Turger test. I'm actually feeling and doing a physical examination of their skin, capillary refill time, things like this. And then again, we can do patch tests if we're doing lasers and things like this. But these other four bits of information here. These are the information that I can do when they're inside the consultation room. Before they come in, I get my team to scan them so that before they've already come in, I've already got one very valuable piece of information that's going to help me improve my patient's skin or regenerative capacity. Why should we focus on the consultation? Obvious reasons. It helps us connect with the clients, ensures the correct treatment plan. If we have the correct treatment plan, we have a safe treatment plan. If we have a safe treatment plan, we reduce the chances of complications and complaints and underwhelming results 3-4 months later on. Find opportunities to upsell other items. So when they're in having regenerative treatments, you can then recommend, oh, okay, maybe you need some lasers to support. Maybe you need some EBDs, energy-based devices. And the beauty of it, down here in yellow, anyone can do it. All levels, whether you're a starter, whether you're 10 years, 20 years in the industry, anyone can do it. All you need to do is gather the information. And like I said, one of the most valuable informations, especially in regenerative aesthetics, is imaging technology. Okay. So once you've gathered the information, this is now to break down the new consultation model moving forward. If you haven't already got some form of imaging technology with to support your regenerative aesthetic treatments, now's the time to invest, because this is the future of AI imaging assisted consultation. We have to educate patients, need to understand the anatomy and aging, then visualize. This is where the scanner comes in, where the imaging technology comes in. Patients can see the baseline and the progression. You can also then align expectations. You can show them this is how you're going to look in 3 to 4 months' time. Okay. And the most important thing, as I mentioned, you can only improve what you measure. You can track progress. Progress becomes more objective over time rather than subjective. Once I've gathered that information from my patient history, from my physical examination, from some patch tests, from my visual inspection, and my imaging technology, I'm in the best position to make my health plan that's going to complement my patient's lifestyle. Remember, you should always make a treatment plan that complements their lifestyle, especially in regenerative aesthetics, because it's such a long, arduous treatment protocol. I even ask questions such as, do you have any travel plans coming up in the next 3 to 4 months? Because that's something that we need to factor in. There's no point making a 3 to 4 or even a 5-6 month plan if your patient isn't in the country or available to come and see you. So these are things that you need to do. Discuss downtime in advance. Again, the imaging technology will help you discuss this appropriately because you can see the current skin health, the blood flow in the skin, the tissue quality as well. The AI systems are now tracking this and it helps you discuss the downtime. You can now make a clear timeline, right? And again, in yellow, because of the topic of this discussion, you can visually align on the end goal. As I mentioned, a lot of the advanced AI systems now that we're using, they can now generate a 3D image of how you're going to look in 3 to 4 months' time with a round of regenerative aesthetic protocols. And then you can give them a takeaway treatment plan. A lot of these scanners now, they actually print a report out. And again, a lot of the clients love this because they can go home and actually see and digest the information in their own time so they can come back and make an informed decision. So we've covered the consultation side of things. A few other aspects that are really important when you're using imaging technology, and if you're going to move forward with this new era of AI-led consultations, you need to be aware of the emotional impact of imaging. Imaging changes emotional perception. Okay, patients now can finally understand asymmetry that they didn't see before. Something that you probably hear a lot. I never noticed that before. I never noticed that because they've been looking in the mirror their whole life. But then when you present it in a 3D structured manner, clear and concise, that they can visually see and see how they stack up against their previous pictures and other people in their similar cohort, they always say, I never noticed that before. And it really resonates with them. It increases trust. People trust you more. Okay. This is a positive emotion and it reduces the consultation resistance, more confidence in your stage long-term plan. Okay. Imaging technology reduces the gap between what the clinician sees and what the patient understands. I always say this to my team. I say, look, you can be the best communicator, but you need to make sure your patient understands. If I say the color red, I might be saying red really perfectly, clearly, and concisely, but my patient might be hearing purple. And that's where the gap is, okay, where of what I'm saying and what they're perceiving. And this is where imaging technology reduces that gap. So we're all aligned. If I'm saying red, they're seeing red and understanding red. If I'm saying purple, they're hearing purple as well. So it's just about aligning it. Some ethical considerations to be mindful of as well as we enter this new era. AI imaging technology should only support your clinical judgment, not replace it. If you're going to invest in these advanced technology such as like I and my team have, just remember this is still human led. It's just supported by AI. It shouldn't be led and dictated by AI technology. It should only be supported. Avoid over promising, especially on the 3D generated models. They will make you look perfect if you want to go all that way. You can scale it actually on the scanner that I have. You can actually scale how your wrinkles will reduce. Don't over promise. Avoid exaggerated 3D simulations. Yeah. Imaging should educate, not oversell. You need to ethically communicate these, and the technology should be used as a tool to enhance your trust of your patient, not to take advantage of it. And just remember, always rely on your clinical skill set, not just the imaging 3D rendering. Just because the AI technology renders an image doesn't mean you can physically achieve that. Know your limits. Are you a skilled injector? Do you need more practice to get that rhinoplasty or that surgical intervention, to the level of the image? Or can you actually achieve the regenerative results that the AI image is promising? So be realistic and trust your own clinical skill set. So where I feel like the industry is heading, okay, the future of regenerative consultations. Imaging integrated consultation is going to be the norm. Like if you don't have this now, in the near future, within this year, in the next year or two, patients are going to expect this. Don't be surprised if patients come to your clinic in the next year and say, how come you don't have a scanner? Because I see it's going to become the norm. AI assisted treatment planning. Okay, they're actually going to now assist with the planning of the treatments. Things are going to be data driven. All your patient journeys are now going to be data driven. Personalized regenerative pathways are going to be the norm in the very near future. Rather than one glove fits all, it's going to be, well, you're going to need 3 or 4 sessions, you're going to need 5 or 6 sessions. It's going to be a lot more personalized, where different doses are required in different areas of the face and the body, and it's going to improve better long-term adherence. Okay, so the future of aesthetic consultations may become less about persuasion and more about visual understanding. And all of this, guys, all of this is to ultimately improve your patient experience. They are going to understand and be a lot more comfortable investing in this treatment and sticking to this treatment plan, even when they can't see the results immediately. They know, thanks to the imaging technology, that this regenerative protocol will work. So, some key takeaways just to wrap up before Chloe joins for the Q&As. Just remember, regenerative results are gradual. I've said it before, but they're gradual and slow, and it's hard for your patients to see the results. Okay. Imaging technology improves the understanding and the trust that you build with your patients during these long protocols. The visualization also strengthens treatment adherence. So, a lot of the time when you get patients falling off the treatment plan, this is going to prevent that. It's going to increase their confidence in sticking with the program for the whole duration of the regenerative protocol. AI imaging is reshaping modern day consultations, as I mentioned on the previous slide. And the future of consultations is going to be increasingly visual and educationally led rather than just verbal alone. And just remember, in regenerative aesthetics, seeing is no longer just believing, it's now understanding. Your patients can understand what they're investing in and what they can look like by the end of your regenerative aesthetics treatment protocol. Thank you all so much for joining and for your attention. Chloe, if you wanted to just share some questions, I'm happy to answer any questions if there are any.
Yeah, absolutely. Thank you so much, Cameron. That was an excellent presentation, really informative. If anyone does have any questions, just in the Q&A box at the bottom of your screen. If it's not showing, press the more button and you should be able to see it then. I'll kick things off, Cam. A question on training teams. You mentioned that some of your team members will do a scan before a patient comes in to see you. How do you decide who should be allowed to do the scanning, and how do you ensure they're appropriately trained?
That's a really good question, something I didn't actually mention in the webinar. The beauty of these devices, especially the ones that I have that I mentioned earlier, they're so standardized. So anyone can do them. Clinically trained, non-clinically
Mhm.
trained, front of house, manager, back of house, because so especially the one I have, it actually guides you and it goes green until you're aligned. It doesn't scan until the patient is perfectly aligned. So what I love about these new AI scanners, like the ones I just mentioned, is they are very standardized. Everyone can do them, and the machine won't even scan you until the patient is perfectly aligned. We're talking, it even measures the tilt of the head, the eye level alignment, everything. So essentially, it's so easy for everyone to use, and that's why our images are so standardized now.
That's brilliant. That's really good to know, isn't it? So it's, you can have everyone involved and it eases workload for you as well.
Yes.
Okay, and then obviously you talked quite a bit about managing expectations. Are there potential risks that AI might create unrealistic expectations, and how do you best manage that?
Absolutely, which is why I made it a point to include that ethical consideration slide there towards the end. You have to be realistic. Do not overpromise. These AI images can go all the way to perfection, glass skin if you want it to. Um, the way I would answer that question is just align the AI imaging and match it with your clinical insight, your clinical skill set. If
Yeah.
you can achieve, if what I would always say to my team is, if you're going to promise an image on the AI 3D generated scanner, just ask yourself, have I ever delivered results like that? If the answer is yes, then the second question is, okay, was the patient of a similar clinical indication? You might have delivered that on a 30-year-old. Can you really deliver that on a 60-year-old? Probably not. So first I say, ask yourself, have you ever delivered that result before in your entire professional career? If yes, have you done it on a similar patient? If yes, then go ahead with it. If you can't, then don't promise it.
Yeah, yeah, that's absolutely essential. And then similarly to that, how do you avoid over reliance on the analysis? Do you think that these devices might sort of de-skill some people, especially if they're newer to the industry? And, what would you say to people about making sure they're on top of their actual learning and not reliance on these devices to assess and analyze skin?
Yeah, that's a great question. You broke up a little bit, but I think I got the gist of it. Was it patient practitioners being over reliant on these? Is that what your question was?
Yeah.
Yeah. Yep. So great question. I mean, look, that's like anything in AI. How many of us now are writing our own emails? How many of us now are even driving the same? We all have self-driving assisted cars now. Like if you have a Tesla, if you have a lot of these new modern day cars now, they have self-driving assisted. I know as well when I put it on lane mode, I'm probably not as sharp. So I guess the answer to your question there is keep on top of your skills. Practice makes, progress, I guess, and you have to just find and be very aware of your own skill set and the gaps. If you feel like your skills are slipping, get into some more training. I give you a real life example of how this has impacted us way before AI. Auto-correcting wording. So remember when everyone got the iPhones? I guarantee you, a
Yeah.
lot of people now cannot spell words the same as they did years ago. If you asked them to spell a word, they could have done. But now, thanks to autocorrect and like predictive texting, way before the AI boom, people cannot spell words. They're like, oh, my phone just does it for me. I don't know how
Yeah.
to spell successful. Is it two C's or two? People don't know. And
Yeah.
it's genuinely baffling. So, the same way, what would you do there? You would do more crosswords. You would maybe pick up a thesaurus. The same way here, if you're feeling like your consultation or clinical skills are slipping, get yourself into some more training and keep on top of it.
Yeah, thank you so much. Yeah, that is such a good answer. Okay, I think that's all we've got time for this evening, but thank you everyone for joining us. This will be available to watch back on our website if you were late joining at all. We've also got lots of other webinars coming up, so check out the website e-learning section to register for upcoming events. And thank you, Dr. Cameron. That was really brilliant. We will see you all soon.
Thank you, Chloe. Thanks everyone for joining, and thank you for Rami for having me. And I really look forward also to the Ramsey conference coming up later on this year in November.
Yeah, absolutely. We'll see you there. Thank you so much.
Thanks,
Bye.
guys. See you. Bye bye.